Did you know that a significant number of men could face prostate cancer at some point in their lives? It's one of the most concerning diseases among us, and its most alarming characteristic is that it often progresses in silence without clear symptoms until advanced stages. How can we act to protect ourselves before it's too late? Join us because today we will reveal 8 key signs that, although subtle, we must not ignore, and the last one is the most common. Unfortunately, many men discover they are dealing with this silent threat when it's already too late. This situation occurs because prostate cancer usually develops discreetly, going unnoticed until it reaches advanced phases, at which point treatment options may be more limited and the chances of cure decrease. But the good news, and a crucial message that we all must keep in mind, is that in the case of prostate cancer, we can make a significant difference if we act with knowledge and speed. Dr. Laura Rodriguez emphasizes that if we manage to identify symptoms early and seek adequate medical attention, the chances of recovery are remarkably high. In fact, statistics show that a large percentage of men who take early action manage to overcome this disease. It is a message of hope that underscores the importance of being well-informed and attentive to our bodies. Although science is still investigating the exact cause of why certain prostate cells become cancerous, advances in medical research have allowed us to identify key factors that can increase the risk of developing this disease. One of the most relevant is age. Starting at 50, the likelihood of risk begins to rise considerably. Furthermore, our daily habits play an essential role. For example, high consumption of processed foods, dairy products, a sedentary lifestyle, and obesity not only impact our overall health, but can also contribute to increasing this risk. We also cannot ignore the influence of family history. If a father or brother has had prostate cancer, the risk can double or even triple. And of course, there are environmental factors. Prolonged exposure to tobacco smoke or certain industrial chemicals can have a cumulative impact that we should not underestimate. The most worrying aspect is that, in its initial stages, this cancer can be practically undetectable. Malignant cells can be developing and multiplying without causing noticeable discomfort. This happens because the tumor initially tends to be small and slow-growing. In many cases, it is not detected until it has grown significantly or spread to other parts of the body, at which point symptoms become evident and treatment becomes more complex. Fortunately, the body usually sends us signals when something is wrong, and in the context of the prostate, many men experience at least one of the 8 key symptoms that we will detail below, and which should be taken very seriously. It is essential to pay attention to these changes and consult a doctor as soon as possible for an accurate evaluation, as early action can be crucial. Symptom 1. Frequent urination, polyuria. One of the first signs that may appear is the need to urinate more frequently than usual, known as polyuria. Normally, urinating between 6 and 8 times a day and no more than once at night is considered healthy. However, when the prostate begins to enlarge, whether benignly or malignantly, many men notice a significant increase in urinary frequency, especially during the night, which is known as nocturia. Symptom 2. Urinary urgency and feeling of incomplete emptying. Added to this is urinary urgency, that sudden and uncontrollable need to go to the bathroom, which can be very uncomfortable and even interfere with daily activities. Furthermore, it is not uncommon to experience a persistent feeling that the bladder has not completely emptied, which can lead to frustration and constant discomfort. Symptom 3. Difficulty differentiating pressures and possible incontinence. Another symptom that often goes unnoticed, according to Dr. Laura Rodriguez, is the body's difficulty in distinguishing between pressure in the rectum caused by stool and pressure from an enlarged prostate. This can lead to a feeling of incomplete bowel emptying, a symptom that many men might mistakenly attribute to digestive problems. In more advanced cases, the situation could evolve into urinary incontinence, where urine leaks become uncontrollable, affecting not only physical health but also quality of life and personal confidence. These changes, although they may initially seem minor, are warning signs that should not be overlooked. Each of them invites us to be more aware of our health and to seek professional help preventively before these symptoms progress. Symptom 4. Persistent lower back pain and nerve compression. A symptom that, although less frequent in initial stages, deserves special attention is pain in the lower back. While this sign usually manifests when prostate cancer has already advanced and spread to other organs, it is one of the main reasons why some men end up discovering the disease. This happens because prostate cancer, when it spreads, has a marked tendency to metastasize to the spine and other bones. This spread generates deep and intense pain that often does not subside with rest or common painkillers. In fact, the pain tends to be persistent and in some cases can worsen at night or when lying down, interfering with sleep and significantly affecting quality of life. It is important to note that this type of pain is not like typical lower back discomfort caused by posture, muscle strain, or natural aging wear and tear. Instead, it is a pain that becomes inexplicable, constant, and progressive, making it a critical warning sign that should never be ignored. Especially men over 50, many discover their condition, precisely because they seek medical help due to this persistent pain. Therefore, if you experience lower back discomfort that does not improve over time or with conventional treatments, it is vital to consider a more in-depth evaluation. Although not all back pains are related to cancer, ruling out this possibility can make the difference between an early and a late diagnosis, where treatment options are much more limited. The spinal cord, that delicate cord of nerves connecting the brain to the rest of the body, is fundamental for controlling movement and sensation. When a tumor exerts pressure on the structure or the nerves that regulate the legs and feet, nerve signals are compromised. This can lead to uncomfortable sensations such as tingling or numbness, to more serious problems like muscle weakness or even paralysis in advanced cases. It is important to note that not all back pains or leg discomforts are related to prostate cancer. Common conditions like herniated discs, muscle strains, or arthritis can also cause similar symptoms. However, there are certain signs that should not be ignored. A sudden onset of stiffness or intense pain in the lower back that radiates to the legs, accompanied by numbness or weakness, can be a warning that something more serious is happening. The crucial thing in these cases is not to dismiss any unusual or persistent symptom. Although these discomforts may have less serious causes, underestimating their importance could delay a timely diagnosis. A thorough medical consultation not only rules out major problems but also provides peace of mind, which is fundamental for those who wish to maintain their quality of life and long-term well-being. Symptom 5. Blood in urine, hematuria. One of the most alarming, yet often underestimated, symptoms is the presence of blood in the urine, known as hematuria. Symptom 6. Blood in semen, hemispermia, or in the semen called hemispermia. These signs can cause distress and confusion as there are several possible causes, some benign such as urinary tract infections, kidney stones, or even minor trauma. However, it is crucial not to overlook that both hematuria and hemispermia can also be indicative of much more serious problems, including cancer in the urinary tract or prostate. The color of the urine can be another important indicator. If it appears in red, pink, or brown tones, it may signal that something is wrong. While sometimes this color change can be caused by foods like beets or medications, blood in the urine should not be considered a simple coincidence. Its presence should always be a reason for medical consultation to prevent an early diagnosis from becoming a lost opportunity. Regarding the presence of blood in semen, although this symptom is sometimes related to infections, prostate inflammation, or previous procedures like biopsies, it can also be a sign that something more serious is occurring. It is important to remember that any alteration in the color of urine or semen should never be considered normal. These symptoms are clear signals that the body needs to be evaluated by a doctor, who can perform the necessary tests to identify the cause and offer appropriate treatment. Although these conditions do not always indicate cancer, prudence is key. Ignoring the presence of blood in urine or semen could delay the detection of a serious problem, so early medical evaluation is always the best option. Symptom 7. Pain or burning during urination. Have you ever felt discomfort when urinating, such as a persistent burning sensation or pain? If so, don't ignore it. This symptom can be a sign that something is not right with your health, especially when it comes to the prostate. Pain or burning during urination is one of the most common signs of prostate inflammation or infection. And while it is not always related to cancer, it is important not to overlook it. As the prostate enlarges, it can press on the urethra, making it difficult for urine to pass and causing that burning or painful sensation. In more severe cases, when prostate cancer is present, pain during urination can become more intense. It is an uncomfortable sensation that can worsen over time and, if left untreated, can lead to serious complications. Additionally, this symptom is often accompanied by others, such as a frequent need to urinate or the feeling of not completely emptying the bladder. If you experience pain or burning during urination, it is crucial to consult Dr. Laura Rodriguez or your doctor as soon as possible. Do not wait for symptoms to worsen, as detecting a problem in its early stages can be key to effective and less invasive treatment. Symptom 8. Painful ejaculation. Now, painful ejaculation is a symptom often associated with prostate problems, including infections or inflammation, but it can also be an early sign of prostate cancer. Pain during ejaculation can feel like pressure or discomfort in the pelvic area or urethra, and in some cases, it can radiate to other areas of the body, such as the testicles or lower back. This symptom is not only physical but can also be emotionally impactful, causing anxiety or discomfort during sexual relations. It is important to note that pain during ejaculation does not always mean cancer. But if it occurs recurrently or is accompanied by other symptoms such as lower back pain or changes in urinary frequency, it should be evaluated by a doctor. The sooner the symptom is addressed, the greater the chances of finding a treatable cause. In the event that it is a sign of prostate cancer, early diagnosis can make a difference in treatment options and long-term quality of life. Have you noticed you're losing weight for no apparent reason or constantly feeling tired, even after resting? These signs can be more significant than you think, especially when it comes to advanced prostate cancer. Unexplained weight loss, accompanied by intense fatigue, are warning signs that indicate the body is fighting a more serious disease. In the case of prostate cancer, when malignant cells spread, they can affect other organs and systems, leading to generalized exhaustion and physical depletion that cannot be explained by common causes like stress or an inadequate diet. Furthermore, fatigue is not just feeling tired. It is a profound sense of exhaustion that does not improve with rest. This lack of energy, combined with weight loss without conscious effort, can be a manifestation that cancer is interfering with essential bodily functions. If you experience these symptoms, it is crucial not to ignore them and seek medical attention for an accurate diagnosis. The earlier the underlying cause is detected, the greater the likelihood of successful treatment and avoiding serious complications that affect your quality of life. If you found this topic interesting, don't forget to share this information and stay tuned for our next video. You'll discover 8 foods that could be affecting your prostate health and how to take control of your well-being in a simple and effective way. Click now and start making informed decisions for your health. Your future depends on what you do today. Until next time.